As we age, our bodies change. This includes our joints. They may not feel as flexible. They might be a bit stiffer, and sometimes they hurt. One common source of joint pain in seniors is bursitis. While it might sound intimidating, understanding bursitis is the first step towards managing it and finding relief. This guide will walk you through the essentials of bursitis. We'll cover what it is, why it's more common in our golden years, and what you can do about it. We'll also discuss how doctors diagnose bursitis and the various treatment options available. Knowledge is power, especially when it comes to our health. Taking care of our joints becomes increasingly important as we age. By understanding bursitis and taking proactive steps, you can keep your joints healthy and continue enjoying an active and fulfilling life. Let's dive in. Imagine small fluid-filled sacs called bursae strategically positioned throughout your body, acting like tiny cushions between your bones, tendons, and muscles. These remarkable sacs play a crucial role in ensuring smooth and pain-free movement. They reduce friction, allowing your joints to glide effortlessly. However, these bursae can sometimes become inflamed. This is what we call bursitis. Instead of facilitating smooth movement, the inflamed bursae cause pain and stiffness, making everyday activities uncomfortable. Imagine trying to open a jar with a swollen and painful finger. That's the kind of discomfort bursitis can bring to various joints in your body. Understanding the role of bursae and what happens when they become inflamed is key to grasping the impact of bursitis on our bodies. As we get older, our bodies naturally experience wear and tear. This is especially true for our joints, which have endured years of use. Just like a favorite pair of shoes might show signs of wear over time, our joints can also experience age-related changes. One of these changes is that the fluid inside our bursae can decrease, making them more prone to irritation and inflammation. Additionally, the cartilage in our joints, which provides cushioning, can wear down, putting more stress on the bursae. This doesn't mean that every senior will develop bursitis. However, understanding these age-related changes helps us appreciate why it's more common as we get older. Recognizing these factors empowers us to take proactive steps to protect our joints and potentially reduce the risk of bursitis. Bursitis doesn't just happen overnight. It's often triggered by a combination of factors, some of which we can control and others we can't. Repetitive motions like those involved in gardening, knitting, or playing a musical instrument can irritate the bursae over time. Similarly, staying in the same position for extended periods, such as sitting at a computer or driving long distances, can also contribute to bursitis. Other factors include previous injuries. Old injuries can make joints more susceptible to bursitis. Medical conditions. Certain conditions like arthritis and diabetes can increase the risk. Infections. In some cases, bursitis can result from bacterial infections. By understanding the common causes of bursitis, we can make informed choices about our activities and take steps to minimize our risk. Recognizing the warning signs, symptoms of bursitis. Bursitis often announces itself through a range of telltale signs. These symptoms can vary in intensity depending on the affected joint and the severity of the inflammation. One of the most common symptoms is pain, which can be sharp and intense or dull and achy. The pain might worsen with movement or when pressure is applied to the affected area. Other common symptoms include stiffness. You might find it difficult to move the affected joint freely. Swelling, the area around the inflamed bursa can become swollen and tender to the touch. redness, and warmth. The skin over the affected joint might appear red and feel warm. It's important to remember that these symptoms can be indicative of other conditions as well. Therefore, it's crucial to consult with a healthcare professional for an accurate diagnosis. Diagnosing bursitis. Getting to the root of the problem. If you suspect you might have bursitis, it's essential to consult with a healthcare professional for a proper diagnosis. They will start by taking a detailed medical history, asking about your symptoms, their duration, and any activities or conditions that might be contributing factors. A physical exam is the next step. Your doctor will examine the affected joint, checking for tenderness, swelling, redness, and range of motion. They will also assess your overall health to rule out other possible causes of your symptoms. In some cases, your doctor might recommend imaging tests to get a clearer picture of the affected joint. X-rays can help rule out other conditions like fractures or arthritis, while ultrasound or MRI scans can provide detailed images of the bursa and surrounding tissues. Accurate diagnosis is crucial for determining the most effective treatment plan and ensuring the best possible outcome. Treatment options. Finding relief and restoring mobility. The good news is that bursitis is often treatable, and most people experience significant relief with conservative measures. The primary goal of treatment is to reduce inflammation, alleviate pain, and restore mobility to the affected joint. Rest is often the first line of defense. Avoiding activities that aggravate the inflamed bursa gives it time to heal. Over-the-counter pain relievers such as ibuprofen or naproxen can help reduce pain and inflammation. In some cases, your doctor might recommend prescription medications for more effective pain management. Physical therapy plays a crucial role in restoring strength, flexibility, and range of motion to the affected joint. A therapist will guide you through specific exercises tailored to your needs and condition. In rare cases, when conservative treatment options haven't provided sufficient relief, your doctor might recommend more invasive procedures, such as corticosteroid injections, or in very rare instances, surgery. Preventing bursitis. Proactive steps for healthy joints. While not all cases of bursitis are preventable, there are proactive steps you can take to minimize your risk and keep your joints healthy. Maintaining a healthy weight is crucial, as excess weight puts added stress on your joints. Regular exercise, including low-impact activities like swimming, walking, or cycling, can strengthen the muscles surrounding your joints, providing better support and stability. Warm up before any physical activity to prepare your muscles and joints for movement. Use proper techniques for repetitive motions like lifting or gardening to avoid unnecessary strain. Take breaks during prolonged activities to give your joints a rest. By incorporating these preventive measures into your lifestyle, you can significantly reduce your risk of developing bursitis and maintain healthy and happy joints. When to seek medical advice. While home remedies and self-care strategies can be helpful in managing mild bursitis symptoms, certain situations warrant prompt medical attention. If your pain is severe, persistent, or interfering with your daily activities, don't hesitate to seek medical advice. Similarly, if you experience fever, chills, or redness spreading from the affected area, it could indicate an infection requiring immediate medical attention. Timely intervention is crucial for preventing complications and ensuring the best possible outcome. Remember, your health is your most valuable asset. Don't hesitate to seek professional help when needed. By being proactive about your joint health and seeking timely medical advice, you can enjoy an active and fulfilling life, free from the discomfort of bursitis.